Uh-huh. Just tell me when I need to
Yeah, I
start.
started. The recording started.
AI in medicine. Today we'll be presenting how AI is used in medical fields by CAIVO STEM team. The objectives of this session are to explain how AI is being used in medicine, identify major areas where AI improves patient care, because nursing, there's a very big problem with nursing nowadays, which AI could solve. We'll recognize both benefits and challenges of medical AI. Well, because as you know, AI isn't perfect, so it has its own issues and hallucinations sometimes. And then we'll also prepare for deeper topics in the future sessions. Prateep, do you want to explain why
Yeah, sure.
medicine needs AI?
Sure. So, medicine needs AI because, as you know, there's often physician shortages because not everyone wants to be a doctor. There's also a very large amount of patient data because, I mean, you can understand how much, uh, like labs and stuff, doctors do for each patient, and now you have multiple patients. It's just a lot. The rising healthcare costs, human error, also need for faster diagnosis. AI can help solve many of these. It can also automate many admin tasks. So yeah, Evan,
I
would you
agree
like
with
to?
you. AI is completely suitable for all these issues. Um,
So
yeah, and
AI.
AI is actually. Mhm.
Okay, I can go ahead. So AI can also be useful in recognizing patterns, like Prateep said, with those issues. It can help with lab results, like Prateep said, wearable device data. So if you're wearing like an Apple Watch or a Galaxy Watch, whatever, genetic information, and also EHRS, which stands for electronic health records. So that those are like the things you can like you're able to log in through like the Novant Health or Atrium Health or like whoever your provider is. You're able to see your health records. That could also where AI could be useful in keeping all that data in one place, as well as medical images, which includes like X-rays and stuff like that.
Yep.
So the types of medical AI, you
Yep.
have classification models, and they determine what something is. They sort of like they name they sort of like sort diseases into categories. Like cancers versus non-cancerous tumor. That's an example. You also have segmentation. So in an image, they'll like analyze the image and they'll like pick out specific structures. You also have prediction. So these are going to estimate future outcomes. They're just like predicting. It's in the name. And these will like predict a patient's risk of heart disease and other diseases. They also have generative AI, which just creates new content, kind of like an LLM, I guess. They'll just like write clinical notes or summarize patient visits.
Yeah, so these aren't precisely specific types of medical AI. This is just how AI could be used and how some AI types could be used in medicine. So, question for you. Would you feel comfortable if AI helped diagnose your illness? Why or why not? I'll give you 1 minute to answer this question. To think about your answer, then you can like answer on your microphone or write your answer in the chat of this meeting.
Officers can also answer this.
So I can start. I would say to a certain
Mhm.
extent, I would feel comfortable with um, with AI helping to a certain extent, to where like they're not using my information that would be sent to anyone else. They're not going beyond the guardrails of like um, my secure information. If that makes sense. Um, but I think I would only like I would feel comfortable using it because I know that it it's new in a way that it can help people, but then I also
Mm-hmm.
have to be aware of like it can also steal my data or like use it or like save it and someone else may be able to view it.
Oh yeah, that's a very good concern. I think somebody wrote something in the chat. Could Anvita, could you read it, please? Because I don't have access to it.
Yeah, so Sia said that she would prefer that a human would diagnose her because of the fact that they are human, and also some diseases are best told to a patient through through a person rather than a machine. I agree with this because I feel like what she said, she mentioned cancer. I feel like some diseases like that carry like a lot of emotional weight, and I feel like machines would just be like monotone and they wouldn't like really like be able to empathize with the person at all.
I agree with this reasoning because, in my opinion, AI is just a tool. It cannot fully replace humans. So doctors will definitely have their place in diagnosing the illnesses. Anybody else wants to answer this question?
I feel like AI would help with like convenience, so like you wouldn't have to go to the doctor for like if you had like a minor issue, and I feel like it would be better if AI was diagnosing it because you wouldn't have to go to like a doctor every time, and it would be like more convenient. But like I feel like for like recurring or like major issues, I feel like doctors would be better just because I feel like they would have like more experience, and it's just like better to deal with like a professional rather than just like AI.
Yeah, I completely agree with you because even right now, you can use AI for diagnosing your mild illnesses. Like I, for example, sometimes write my symptoms in AI to see if I need to see my doctor or not. So yeah, I agree with you. I guess we'll go to the next slide. You can check out this amazing research paper from PubMed Central. It basically says that the emergence of AI-based wearable sensors. It states it. Uh, it states that AI-based wearable sensors improve digital health technology. Yeah, medical data that AI uses.
I can do the first one. So for medical imaging, which is basically your X-rays, ultrasound, MRIs, CTs. Basically, those are for your this brain scan. Basically, what the street name is really called brain scans. A bone scan. Basically, any type of scans you get. This is mostly what it's called medical imaging. How can AI help with that? So they it's able to be visualize the internal organ and tissues that it can assist a radiologist and X-ray technicians. Um, like I think we mentioned back a few slides ago how it's able to highlight different tumors. Um, as like a type of medical AI. That's what it's used for. Also, there's a real world example of this. Mayo Clinic uses AI for kidney CT scans and for MRI scans, and they use this in hospitals right now. And there is some ethical issues that need to be kind of looked at in terms of this, as like should AI be allowed to view your own scans and your own images of your body and like and a view of yourself. So yeah, next slide.
Mm-hmm. I can do that. AI could be also used. AI could also use patient data, which includes EHRs or electronic health records, lab results, physician notes, and medical history. And AI could analyze it to basically support clinical decision making because many types of illnesses depend on the patient's background. For example, John Hopkins developed True's AI to analyze patients' vitals to detect sepsis. And Epic integrates AI in EHR to optimize admin work. And would you like to do this?
Yeah, I can do this.
Yeah. Oh.
Oh, sorry. Vita can do this.
Okay. Um, so for AI wearables, so AI powered wearables are smart devices such as watches, fitness trackers, and biosensors that continuously monitor physiological data such as like heart rate, blood oxygen, your ECG, your sleep, and your activity to like detect health issues and support preventative care to make sure like you're tracking everything and preventing like any diseases or anything like that. And then Fitbits and Apple Watches use AI to identify trends in heart rate, sleep patterns, and breathing, helping detect early signs of stress, illness, and cardiovascular problems. And I feel like this is a good benefit because a lot of people use like use Fitbits and Apple Watches in like their daily life. So I feel like this is like a good addition because many people around the world like use it. And then for Dexcom continuous glucose monitors, they use AI algorithms to predict dangerous highs or lows in blood sugars, helping people with diabetes take preventative action. And and the last one, Bioformis, they develop AI-powered wearable platforms that monitor patients remotely, which allows hospitals to detect early signs of heart failure and patient deterioration before hospitalization becomes necessary.
I also want to add something more about this. So like I have Apple Watch too, or like my mom does, and basically what it does is it takes a heart rate, right? And you're basically able to ask Siri, which is Apple's AI. You're able to basically ask Siri, what's my weekly heart rate, what's my monthly heart rate, what's my heart rate right now, and it'll basically find that data and it'll speak it out to you, which is like a pretty easy way of getting information to you. Next slide. So I'll take this one. So this is our discussion question. What type of data do you think is hardest for AI to analyze? Medical imaging, wearables, or patient data? Um, Also think about which one will be most susceptible to variability, such as like um, AI might not do so, might not look at the data so well if there's variability in it. So just answer in the chat, or you can answer out loud and just tell us what you think. Which one? There's like no right or wrong answer for this. It can be any of these. Just um, give like a really good reason for it. We'll give you guys like 1 or 2 minutes to uh, type in the chat or just like speak out loud.
Personally, I think medical imaging would be the hardest for AI to analyze because, uh, like I've often like sent pictures in ChatGPT and it's really bad at reading stuff and identifying stuff in pictures. So I wouldn't really trust it with important diagnostic scans and stuff.
I personally think that wearables would be the easiest to analyze since AI could just directly get the data. Patient data would be kind of hard because it also depends on the wording, and AI is not smart enough to analyze certain concepts rather than words. And medical imaging with right training could be pretty actually easy to analyze. And right now, it's not very popular and it's not very practical because AI just isn't being trained on medical imaging. And imaging is one of the easiest tasks for AI to do. Okay, I guess I'll just go to the next slide. Leading healthcare AI platforms. Okay, Pratip, I think you got this.
Okay, so Epic is one of the largest AI platforms. Has it basically helps physicians manage like patient information and clinical workflows. It sort of does all of the admin work for them so that the patient can just focus on so the physician can just focus on diagnosing patients and stuff. So what the AI actually does, it can like analyze medical history, labs, and physician notes and stuff. So, additionally, it can also like predict sepsis. You know, remember in one of the first slides we were talking about prediction, right? It can also predict deterioration, sepsis, and other clinical risks. It's been integrated into 2,000 plus hospitals all around the US. Yeah. We also have AI Doc, and this is like a platform that mostly assists radiologists. It's focused on it's for medical imaging mostly. it looks at picture. It looks at CT, MRI, and X-ray scans. So it can basically detect strokes, brain hemorrhage, and other diseases around those areas, which can mostly be detected using scans. It also prioritizes emergency scans, so radiologists review the most critical patients first. One of the main improve benefits of using an AI for medical scans like this is that it can be really fast, and that's actually very important for critical cases like these because the patient can die at any moment. So AIs like this can actually make a big difference. So far, it's only been deployed in 900 hospitals and imaging centers worldwide. You can move on to the next one.
I'll take this one. So,
Sure.
going more onto like the stroke detection that Prateep was talking about, the IZ.ai is basically like another stroke care platform, and it's designed to look at different CT scans and to basically alert specialists on mobile devices if there is an instance where someone may have detected a stroke in the patient. It uses multimodal generative AI features that integrate with electronic health records to actively track and prevent like the strokes in different patients that's inputted into its own platform. So it's constantly learning from its patients while also helping the patients out.
Okay, I can take this. AI is also used for disease detection. For example, MedPA-LM, which is a large language model from Google Research designed for medical domain. They basically researchers from Google developed AI model for medical diagnosis. It uses AI imaging and patient data, which we mentioned in our previous slides. So it uses deep learning to detect breast cancer and skin cancer and other diseases like tuberculosis, etc. It was trained on millions of medical images to identify subtle abnormalities, which are often difficult for humans to detect. Again, as I mentioned in our previous slide about AI imaging, it is actually used in organizations such as Moorfields Eye Hospital and the NHS. And it also collaborates with different hospitals and universities to improve this platform.
We also have Tempus AI for precision medicine, and it mostly it combines clinical records and genome sequencing, so your DNA and stuff. And it helps with those things. It can personalize patient treatment. This is DNA analysis is sort of like the main thing of Tempus AI. It's very useful for cancer diagnosis and some hereditary illnesses and stuff. It's used by thousands of oncologists and hospitals all around the USA.
And mainly most
And
of
this proves, yeah,
this is bioinformatics, which basically is you're like you're incorporating computational models and AI models into the biology and cellular biology. So this is basically what Tempest would does. So we
this
already got like
also, yeah, okay, this also proves how AI could not only be used at the macro level, but on the micro level on the DNA. So which platform do you think has the greatest potential to save lives and why? Again, just to remind you, we have Tempus, which is AI for precision medicine, Medgemma, which is AI for disease detection. Then Viz AI for stroke detection, iDoc for medical imaging, and Epic for EHRs. I'll give you 1 minute or 2 minutes to think and answer.
I can go first. Uh,
Mm-hmm.
so, so to me, I think that a Med Gemma, the Med Palm or Palm, that one seems to have the greatest impact because um, it's able to not only use its models for medical diagnosis, but also is able to learn from what it's doing, but also be trained by medical images in a sense to also think about like disease detection, right? Like number one cause of death in America is heart disease, I'm pretty sure, and like most people die of like diseases. So this would most likely lower the margin of deaths potentially. Th- Uh, uh, then the other ones, So this one I think would do the most, but you guys can
Um,
definitely.
I I agree with you, but I think we should also give the respect to Tempus because it analyzes a micro level, a very small DNA mutations, and I think this AI has the biggest potential because we're not we, but researchers are starting to develop more biotechnologies and DNA DNA changes, so like CRISPR and stuff. And so this AI will definitely help in the future.
I was also going to talk about Tempus AI, because I mean, many times physicians wouldn't normally consider like a genetic disease unless they have like a very strong suspicion to do so. Uh, and if Tempus AI mostly looks at that, it could like alert physicians about these beforehand. I also think that the AI doc, the medical imaging thing could help because oftentimes when people have strokes and brain hemorrhage and stuff, these can kill a person very quickly. So it's very important that people act on them as fast as possible. If doctors are analyzing them, they may take time, which the patient doesn't have. Yeah.
I could see
Okay, let's go to the next section. Yeah.
I could see Tempest because honestly, when you think about it, when someone gets cancer, right, they're first gonna ask about symptoms, then they're gonna ask about family history. But they could use Tempest to look at genetics and to see if it's hereditary. So
Oh yeah, to prevent the issue even before it exists. So with
yeah,
Tempus, we could prevent genetic abnormalities.
yep, or mutations, yep.
Okay,
Okay,
here's an activity. Alvita, would you like to present this activity to people?
Yeah. So for our activity, can AI diagnose the patient? First, you're gonna want to like choose an age 5, 12, 18, 30, 45, 65, or 80 years old, and then choose a gender, either male or female, and then choose four of the symptoms from the list below, and then after that, ask DXGBT, and then go to like the link on the slides, and then enter your age, your gender, your four symptoms, and basically ask it like what could this patient have so that it can try to diagnose um your patient.
and then
So yeah, just go to this website and enter all this info if you enter what you want like from this list
Evan,
and
could
give us
you
the answer.
also, Evan, could you also give like a demonstration, just like share?
yeah, sure,
Oh
Yeah.
yeah, let me remove my
definitely.
screen then.
Um, So I went to the link. Now I'm going to. Can you guys hear me?
Yeah.
Yes.
Okay. Now I'm gonna choose. Let's just choose 30 years old. So um, I'll just say male, 30 years old. What I want to do? Let's do vomiting, um, rash, fatigue. Basically, just like you feel like you're gonna like pass out, and shortness of breath. And now I just ask, what could this patient have? like loads. Okay, so it gives many options, just like any a GPT model would do. But it's looking more like matching symptoms would probably match anaphylaxis, which is basically a severe rapid allergic reaction that can cause skin symptoms, gastrointestinal symptoms, and breathing difficulty. So it does like take what you put in there, and it matches with them, and it sees and it tells you what it doesn't match with. However, I might have just found a better one. Cause this one gives one non-matching with fatigue, but this might be like the actual best one, or like it gives you like many different cases because they can all vary. So meningococcemia, um, probably like a bloodstream infection because meninge is like use uh, in the cardiology field. Anyways, so it could be this one, or it could be this one, or it could be this one. Um, but if you narrow it down in terms of this, in terms of the symptoms, it might be something different. So just give it a try and like paste it in the chat, or or paste your prompt and then paste what it gave you in the chat. Cause like I'm in, intrigued.
When you're pasting it in the chat, you can just like copy paste the top illness, you know, text from it. We're gonna wait for like 2 minutes while y'all
Yeah,
use
because it
the
takes more
XD.
time to enter
Yeah.
things than just think like your opinion.
I was on mute the whole time. Anyways, like I was saying, so I just read a CS and 45-year-old female, a shortness of breath, a chest pain, runny nose, and cough. And it gave her the common cold. It also gave her acute bronchitis. So like one ethical thing that I've seen before is that it's more of like you use the DXGPT for self-diagnosis. So like if you don't want to basically go to a medical facility and have them basically tell you this and like pay money, this would be your option. However, this is AI. It's not nearly perfect as you may think it will be. But if you did spend the money to go have in person a physical face to face thing with an actual doctor, they can be able to might be able to give you more accurate results because like you're in their physical presence and they're able to tell you stuff. So it's more of like there's like many factors that can play into using AI to help or not using it.
Yeah, I think I can go to the next slide. But yeah, again, this has ethical issues, as Evan mentioned, because how would AI get regulated? How can hospitals afford using AI? How can it remain unbiased because lots of trained data is actually biased towards white people because they have the most amount of data. So AI couldn't be as accurate with other skin colors. And who will be responsible when AI makes a mistake? Right now, when a doctor makes a mistake, the doctor will be directly responsible, and they're gonna revoke their ID, not ID, their license for being a doctor. But if AI makes a fatal mistake and you die because AI made bad prescription, nobody would be responsible for this. So that's still an open ethical question. There are also benefits and limitations of AI medicine, which I think Prateep could present to you.
I can do cons. Pretty like here's the
Sure,
pros.
I can do pros. So firstly, it can detect diseases early on, you know, because it's constantly looking at your data. It can also improve diagnostics because it's faster. It can also be more accurate in some cases if it's trained enough on that kind of disease. Uh, because basically it automates image analysis and stuff. That's why it's faster. It can also give treatments and stuff personalize them. It also reduces admin burden. I think that's one of the biggest things that AI can do for hospitals. I mean, you can do the cons now.
Yeah, the cons. So one con is the bias in training data. So some AI models may perform poorly on populations that are unrepresented. If it's not like trained properly to do so. Also we like want to think about patient privacy concerns. I mentioned this before. There's like large amount of sensitive health data that people may not want to be shared to a server or something. There's also a risk of misdiagnosis because AI is not always perfect. It can also produce false negatives and false positives. I learned that in like science olympiad one time. Anyways, and it should not replace a physician judgment. So like I said, it's like a battle between AI versus like real doctors, and then there's also high cost. So developing, validating, integrating AI systems into hospitals require lots of time and money spent to do this. Even though it may seem easy to do, it can be kind of hard to train it and put money forth and have like an accessible thing for people to use. So next slide. So looking ahead, if you guys joined today, we have more stuff planned. So next week we'll have I think it's a 2 day session with Huntington's 5 Foundation. My friend Sai, he runs that, and basically it's like a disease, and like I don't know, like it sounds very vague, but like we'll get more into it and how AI is able to help and impact this. And then our session 4, we're planning to do a collaboration size partnership with Next Neural Exploration. You might have heard of them before if you live in the Charlotte area. And we're planning to do something with them. And then after that, we will go into our output, which we'll talk more about that. And I just want to say, I kind of like the ethical issues that we like talked about. I think we can like definitely use that as like an output. We could like do something with that. Who knows? So yeah.
As an output, you could also
Thank you for
use,
your attention. Here's our website. It's going to be updated, by the way.
yeah, Iskander worked on it a lot.
Yep. We have any other questions from Sam or Payush or Sia or Anwita? Do you guys have any questions for us in terms of like input, output, like the sessions we have for next week or like any of that? You can you can type in the chat if you can't like open your mic. Oh yes. We we actually put the attendance doc in Discord and in Band. If you go back to my message or if you pinned it, there's an attendance doc in there. But actually, we're actually planning to do away with the attendance doc because we can just check off names based on who's in attendance. Like, there's no point in you wasting your time having to fill out a form. Like, when we're able to just see who's here, who's not here. So we're not going to do the doc anymore.
I mean, the sessions are being recorded, so we can always look back
Yeah, we
on
can
them.
always yeah. So yep. So look out for another message from us about the next session. The next session is gonna be, I assume it's probably gonna be like much bigger because we'll have um, HSF their cohort will be coming in, and their main audience is like middle schoolers and elementary schoolers, and yeah, so you'll be seeing a lot of kids and stuff.
Yeah.
So yeah,
I'm
thank you
gonna
guys for attending, and we'll see you guys in the next session.
I'm gonna end the recording
Thank
now.
you for your